and welcome to the Plastic Surgery Practice Podcast on the MedCore Podcast Network. I am Keri Stephens, the co-chief editor of Plastic Surgery Practice. Today, I'm joined by a good friend of the podcast and regular guest, Dr. Alex Zuriarrain. Dr. Zuriarrain is the founder of Zuri Plastic Surgery in Miami, where he specializes in aesthetic procedures of the face and body, including facelift, eyelid surgery, breast augmentation and reduction, abdominoplasty, liposuction, the Brazilian butt lift, and rhinoplasty. It is the latter topic, rhinoplasty, is what he's going to be talking to us about today. So, Dr. Z, thanks for joining me today.
Thank you, Keri. Always great to be on the podcast. Thank you so much.
We love having you. To start, what are the most popular trends in rhinoplasty right now, and how has this so-called Zoom boom impacted rhinoplasty in any way?
Yeah, the Zoom era has really changed the game. I think so many people are now working from home. They're really involved in these meetings where they're actually looking at themselves. I think more than the person that they're talking to. A lot of times when they're on these Zoom meetings, you can't help but just see all of these little details when the screen is on you the whole time, which doesn't really happen in normal conversation. If you're just talking to somebody at the office or in the street, you're not really looking at yourself as you make all your facial expressions. So it's really brought about a lot more people looking for rhinoplasty surgery, looking to correct nasal deformities, nasal shapes, saddle, humps, on their noses and the tips. And, so it just brings a lot of, I think, a lot of insecurity in a lot of people.
So, how has rhinoplasty evolved over the years in terms of surgical techniques and outcomes?
Well, it's progressed dramatically over the last, I would say, 30 to 40 years. The technologies have changed quite a bit. Examples of right now, technologies that I use are, for example, something called ultrasonic rhinoplasty, which is out of Italy, an amazing piece of technology that allows us to shave the bone down in a very, very delicate process to get very, very, detailed results. Before it was much more of a chisel and a hammer type situation where we would, basically be molding the nasal bones. But we've come a long way with ultrasonic rhinoplasty. We've come a long way with really understanding the nose, the architecture, the cartilage, how it reacts over time, different modalities on, how to, use actually non-biologic tissue to basically reinforce the nasal dorsum. So there's a lot of things that have come around technology-wise for rhinoplasty that, have really, really changed the game. Also, the lighting that we're using now, being able to use much better lighting inside the nose, fiber optic lights, better headlights, retractors. So everything just evolves, more and more over time.
So, let's get into the technology now. How has the use of technology, such as 3D imaging and computer assisted surgery, impacted the field of rhinoplasty?
Yeah, so computer 3D imaging has come around in plastic surgery for not just rhinoplasty. It came around for other body parts. One of the other most common body parts was to use it for breast augmentation. They would basically use the similar technology to try to reproduce what the results were going to look like. With noses, it's the same idea. You're basically scanning the nose, scanning the facial architecture, using a software program that then generates the image and then allows the plastic surgeon to basically tweak the image in a way in which they would work on the nose and kind of what they would expect the nose to look like after they had operated on the nose. A lot of lawsuits unfortunately came from those 3D imaging devices, not only in breast surgery but also in rhinoplasty. And the rhinoplasty patient population is a very, very delicate patient population. Of all of the patients seeking plastic surgery, rhinoplasty patients are the ones that tend to exhibit the highest levels of anxiety and depression and body dysmorphism and thinking that their nose is, looking a certain way, but it's really not for the rest of the people around them. So it's a very delicate surgery, and 3D imaging, although can be helpful, I would say that for the most part, it's not something that I employ in my particular practice, because it can get you into a lot of trouble when, for whatever reason, the result is not exactly the same as your 3D image that you showed the patient, and then you can get into some big trouble. And just remember, like every conversation that we have on the podcast about every other type of plastic surgery that we perform, the human body has its own way of recovering, of adapting, of changing, of responding to the trauma of surgery and inflammation. And so to guarantee somebody that they're going to look just like a 3D computer generated image, I have my concerns about that, and so I choose not to dive into that world.
No, that makes a lot of sense. And you mentioned the body dysmorphia aspect. Are there any population that is not good for rhinoplasty? I mean, other than, patients exhibiting with body dysmorphia, are there any other patients that you would say, not perform surgery on for rhinoplasty?
Yeah, there's quite a few patients that I would tell you, actually, Keri, that in my practice, I deny more rhinoplasties than I perform by a
Oh,
disproportionate.
wow.
Yeah, it's one of the surgeries that I am most selective on, when I offer to engage, in helping somebody, with their concerns. There's an acronym that anybody who's listening to the podcast, any plastic surgeon who listens to us, is going to laugh because they're going to remember this from their fellowship. But it's called Simon, and it's basically single, immature male who happens to be overly narcissistic. So those categories, of patient are always very concerning, as are the patients that are doing surgery for reasons outside of the norm. For example, you have a TV news anchor, who she feels that if she doesn't get a rhinoplasty, she's not going to get a promotion, or she's not going to stay on the TV channel as a broadcaster because she's got this nasal defect. There's other people that come and they say that they're perfectly fine with their nose, but their significant other who they're dating, really dislikes their nose. And so they're coming in because they want to make their significant other happy with the way that they appear. There's then the body dysmorphic patient, like we talked about. You're looking at them in the mirror, they feel like they have a hump on their nose and they don't have anything at all. And then there's the patients that are just totally unrealistic, that they say, I want you to shrink my nose, I want you to make my nose physically smaller. Yeah, that's not entirely possible. I can't shrink your nose like I shrink your breasts, right? And I can't make your nose bigger like I make, other body parts, like your buttock with a BBL. That's not that's not the architecture of the nose. That's not how it works. But again, there's a lot of patients that come in. Also, there are some surgeons that they have a niche with particular types of noses. For example, Middle Eastern nose is very different than a Caucasian nose. There's some surgeons that really like to dedicate themselves to ethnic noses, which can be African American noses, Asian noses. So every geographic area has a very particular cartilage and bone, anatomy to the nose. And the nose, honestly, is one of the most complex structures in the human body. And it deserves a lot of respect. And you just don't offer a rhinoplasty to anybody.
That is really interesting. So, okay, I want to get into the complications now. So, what are the most common complications associated with rhinoplasty, and how can they be minimized?
Yeah, so the most common complication with rhinoplasty, beyond the initial prolonged swelling that a lot of patients don't really want to grasp, they think that you have a rhinoplasty and then a week or 2 weeks later, like that's it, like I have my final result, right? And it's actually quite the opposite. It is one of the only surgeries that you'll read in the textbook in that'll tell you that truly the final result is at 1 year after surgery, like a full 12 months. Every rhinoplasty textbook will say it. And the problem is that in society, what has happened is that a lot of the surgeons, they do these reveals. So, oh, Nancy got her rhinoplasty. She's back on, 1 week after surgery. We're gonna take off the splint, and and then just look at her, like, look how amazing she looks like a week after surgery. That is not the reality. The reality is that most patients need a lot more time for their swelling to come down. Besides swelling, I mean, complications with rhinoplasty, can be pretty bad if it's done incorrectly. So one of them is, for example, a saddle deformity. So it's some patients who have a very, very, strong hump at the top of their nose. If you start, whittling down and either ultrasonic rhinoplasty or chisel or whatever you're going to use, if you're too aggressive with that, you can leave them with a literal saddle hump, or saddle indentation, rather, like a U-shaped deformity in their nose. And it's a huge problem. Very difficult to fix that kind of issue. Other complications can be if you're trying to harvest some septum, some cartilage inside the nose. You can do some internal damage there where things don't heal properly, and they end up with what's it called, like a whistleblower deformity, where every time they speak, the air that's passing through their sinuses crosses through their septum, and it makes a whistling sound. Very odd complication. Very, again, another challenging thing to fix. So you don't want to go to rhinoplasty to just anybody. You have to be very careful. There's also collapse of the tip that can happen if the surgeon is overly aggressive trying to reduce the tip of the nose. Some ethnic noses have a much wider nostril base. So in attempt to try to make a narrower nostril base, you take off extra tissue from the lateral nostrils. Then you can get notching there. You can get a keloid or a bad scar there. So yeah, it's one of the more challenging surgeries. It can be very rewarding as well if you select the right patient and you select the right surgery for that particular person. But yeah, it's no joke. It's not a chip shot.
Well, I can't think of a better entry to the next question. And this is actually my final question. So, what is your approach to balancing patients' desires for a specific nose shape with their facial features and overall aesthetic goals?
Yeah, so we balance that with a very in-depth analysis using an iPad and a large flat screen TV, where I sit down with the patient. We look at their photos in depth. We zoom in, we zoom out. We look at every single angle, every single profile, everything you can imagine. We do an internal nasal exam. We make sure that they don't have a functional respiratory problem that would lead them to have to go see an ear, nose, and throat doctor for an evaluation. And you have to separate the functional parts of rhinoplasty from the cosmetic parts of rhinoplasty. But overall, it really comes down to the consultation, to the discussion with the patient, and setting very realistic expectations. Again, a lot of it based on their existing structure, but also on their ethnicity and their genetic background, which plays a huge role in their outcome and in their, honestly, in the way that they're going to look after the surgery. So you have to sit down and spend a lot of time answering questions and looking at photos, because whenever you encounter a patient that is, seeking a particular nose that is just not going to happen based on their existing framework, then you have to be very careful not to offer them surgery, or at least to offer them to see one of your colleagues, to get multiple opinions, regarding that particular surgery. So they don't have to take your word for it necessarily as a surgeon, but if they hear the same feedback from two or three board certified surgeons that have good experience, then they need to be careful what they do.
Well, thank you. As always, Dr. Zuriarrain. This was very informative, and I know I learned a lot. And to our listeners, be sure to subscribe to the Plastic Surgery Practice podcast on the MedCore Podcast Network and check out plasticsurgerypractice.com to keep up with the latest industry news. Until next time, take care.